Can you tell me a little bit about you and your GSD journey?
Hi, so my name is Shaylee, and I am a last semester college student living with Pompe disease, which is DSD type 2. I was diagnosed at age 12, which is interesting because that's decently early for a late onset Pompe disease patient. At the time, we now have newborn screening and a lot of other things that make it diagnosable at birth, but at the time, the average patient was not diagnosed. Even now, the average is still technically being diagnosed at age 50. Um, so I was diagnosed through a muscle biopsy because Pompe disease causes muscle deterioration, um, and so deteriorates the muscles. So yeah, I receive, and unlike other types of GSD, Pompe disease is treated with an enzyme replacement therapy. There are now officially 3 drugs on market, um, one by Amicus and 2 by Sanofi. Um, I personally receive a medication by Sanofi and receive it twice. Um, I receive it weekly. Um, so yeah, I receive twice the normal recommended dosing weekly. So yeah.
Can you explain a little bit more about the enzyme replacement?
Yeah, so Pompe disease is caused by a deficiency of the acid alpha glucosidase enzyme, which is an enzyme that um, does not allow you to process glycogen in the lysosome of the cells. So I believe it is the only glycogen storage disease that is impacted the lysosomes of the cells, if I remember correctly, which is interesting. But anyway, so because we have a deficiency of the enzyme, we get a synthetic enzyme infused. It was originally developed, clinical trial started in 99, and then it was approved for pediatric patients in 2006 and adult patients in 2010, I believe. Um, so yeah, it's interesting because unlike a lot of types of GSD, we don't have to have cornstarch or other things, but the complication is we do have to have an IV or some sort of intravenous. Some people get it through a portacath infusion, and the fastest person I know gets his in 3 hours, but that's the fastest. Most of ours takes about 6 to 7, between 4 and 6 hours every week that we have to be attached to an IV pole. This medication is very complicated. It's decently unstable, so
And do you
uh,
do that at home or do you go to the hospital to do that?
it depends on the patient. I have done a combination of both. Um, uh, yeah, I've done a combination of both. It depends on several different factors. But yeah, the biggest issue, the reason I have issues compared to some other Pompe patients is the medication can't be shaken. And so a lot of Pompe, especially the younger ones who might not have as much impacted, they are able to wear it like in a backpack or in a fanny pack. But because I am not very steady when I move, it shakes the medication too much. So I have to keep mine on a pole.
Have you ever faced adversity with GSD or felt like you were treated or looked at as different for having GSD?
Yes. So Pompe disease is, um, I don't know about the other types of GSD, as well as Pompe, but Pompe disease is considered a terminal diagnosis. It is considered degenerative and it will kill you, just a matter of when, to be frank. Um, and so, and conserving energy is the name of the game. So, for an example, I can tell you there's a time I was at Costco and I was pulling out of a handicap parking spot. Like I had it in park because I was, getting ready to pull out. And someone knocked on my window and said, this is reserved for people with disabilities. And I said, absolutely, I do have one. Um, and there's a variety of other things. Ironically, I was in a genetic class and the professor was making comments about kind of eugenics and about how people with genetic disabilities didn't necessarily just have to be there. It's first class of the year. It's a whole mess. But anyway, I do have to say though, it's hard for me to determine the line of what adversities I face because of Pompe versus my numerous other conditions, because I jokingly say I get all my parents' crappy genetics. My brother has to wear glasses. That's his only crappy genetics. Um, I have 4 genetic diseases. Most of them are pretty mild. I mean, one of them, the only thing we know about it is it causes me to need to wear hearing aids. So not super complicated in the fact that it messes with my everyday life. Well, that's the easiest way for it to mess with my everyday life because I, um, not being able to hear everyone 100% is very annoying. But from the other perspective of when I use no mobility devices and I try to access any type of accommodation, I get looked upon. I get people asking questions, are you sure you need it? I get glares. I get people whispering to other people. Whereas if I use any of my mobility aids, then it's generally more accepted, especially if I was to use something like for my orthotics, though, I still sometimes get whispers because people don't understand that they're orthotics and not like soccer shin guard things because they kind of look like shin guards. So it's a very interesting situation. So yeah.
How has Pompe disease influenced your college journey?
So Pompe disease has influenced my college journey from the absolute beginning. Um, because of advocacy work I do for Pompe is actually how I ended up choosing the college I chose. And so I try to look at how Pompe has positively impacted my life and not negatively impacted my life. I'm not going to say there aren't negatives because that's lying to everyone, but I have to also be realistic and say it's given me so many things. My college experience started in fall of 2019 as a full-time college student. And we all know what happened spring of 2020. To make matters more complicated is I had planned a major surgery for March of 2020 and July of 2020. So those were all postponed. I ended up having surgery in July of 2020 and in November of 2020, but it really made an impact on the rest of my academic career. Furthermore, I go to a college we are celebrating our bicentennial year this year, so that means it's 200 years old. And that comes with its own unique situations because we do not have a fully accessible college. However, unlike a lot of colleges that say we are accessible because we've updated our building or done like gone through and done construction on things since the ADA has been passed, and just claim it's accessible. What my college does is they actually make everything accessible to my needs as much as possible. For an example, I prefer when I'm walking, I prefer stairs over ramps. However, there are days I need elevator use or first floor access. So what my college has done is made sure that I have both a stairs option and a elevator option to most of my classes, and that I don't have to rely on any ramps. Whereas per the ADA, I would have to rely. They would generally say, well, it's accessible because there's a ramp and there's door openers, which isn't 100% accessible for me. So I have a college that's great about working with what's accessible for my needs. And so we've worked with the registrar's office to make sure I have first floor classes, that they're all on my side of campus, so I don't have to walk to the other side of campus. So yeah, it's very interesting.
And was
Just
that an easy process going about that?
honestly, it was the easiest thing ever. That was part of how I chose a college, is I started reaching out to the colleges that accepted me, and I reached out to their ADA office and I started asking a bunch of questions. And one of them literally said, whatever your doctor asks for, we can make happen as long as we have the ability to. And so that's a college I ended up choosing. And it's taken the least amount of worries from me. It's a very seamless process, which I thoroughly enjoy.
What has GSD taught you? For example, discipline, time management, for example.
So I kept the main thing it's taught me is that we aren't promised tomorrow. We are promised, we weren't even promised today. We're promised now because we're living in the now. So I live like there is no tomorrow, quote unquote. I've had the opportunity to travel to 3 different continents. Um, and I have a prioritization list of my life. And it changes depending on the day, the month, the year. And so I think that's also very important. So, for an example, my faith in God is the most important thing to me, then my family, my adorable dog, my academics, travel, crafting, reading. Those can all most of those can all switch and be fluid. Some days traveling is more important than spending time with my dog. Or, but also in there that I forgot is my medical life. And that's the one that tends to float around the most. Sometimes I've had to choose. I'm not, like, for an example, this year, I'm not going home for Thanksgiving. I'm going to go spend time with some friends that I live with that live near my college because I live across the country from my parents. And it's just not worth it for me to travel back and forth because of the fatigue issues Pompeii causes. However, there's also been times I choose family over other things, but I've had to make the hard decisions at times. For an example, I've been given the opportunity to do some different traveling, and I had to make a decision. Do I go and say yes on this trip, or do I and push myself from a health perspective because I normally get infusion every 7 days? Do I push it to 10 days, or do I get infusion and make my body feel better? I'm going to say the answer has been at both times yes to each of those questions. Some days it's no, I have to say no to a vacation, but yes, I will take care of my body first. And sometimes it's this is a once in a lifetime opportunity. My body will just have to survive because otherwise, what good is it doing? If I don't have the quality of life I want, what difference does it do for me to push my body and throw everything I can into my body's health?
And then we were talking over on the phone, texting, and you mentioned you had a transplant. Is that correct?
No,
No. Okay. That must be
that was
somebody.
someone else in the comments.
Sorry about that.
You're
Um,
fine. Pompeii doesn't actually have a transplant. So we get what we get with life, and good luck. Um, so Pompeii will eventually cost me my ability to breathe. And that's generally how most late onset Pompeii patients die, is from respiratory distress because we don't have the muscle strength to move our muscles because our cells die one by one, and because everybody in especially your muscles need long-term energy from your cells. Every muscle cell in your body can be affected by Pompeii.
what is one advice you would give to those with loved ones diagnosed with GSD, like a parent, and what makes you feel best supported by others?
It depends on the day. Today, we're going to go with the National Organization of Rare Diseases mission statement, I believe. Alone we are rare, but together we are strong. There's no Pompeii patient or no GSD patient that's the exact same. We're all different. But through our community, you can make sense of what's happening. You can form the community. It doesn't feel as isolating. You can find people to bounce ideas off of. You can find people to support you in your journey. So that's what I've got for today.
And outside the Facebook page and the annual conference with GSD, what is one thing you're hoping to see more in the GSD community happen?
So I will say this from a Pompeii perspective, the GSD conference is generally not worth going. I have never decided to go because a lot of the focuses are on the similarities between the GSDs and Pompeii disease and the treatment of it. is very different than a lot of the other GSDs because we are the only lysosomal storage disease. So there's generally only a few talks that happen at the conference that are applicable to patients with Pompe. So moving forward, I would love to see Pompe being included as well, because not just from the biomechanical side of things, but also just going back to the statement of alone we are rare, but together we are strong. Pompe, with Pompe being taking more of an active role, I think there's lessons to be learned by different types of GSD and how, even though we might treat it differently, because I know other GSDs sometimes they're treated with cornstarch, which I'm ironically allergic to.
And then I know you're allergic to cornstarch, those other starches like tapioca, I believe.
Well, so I ironically developed food allergies, but because of Pompe, that we don't use any type of starches. We just use the enzyme replacement therapy. But I think there's lessons to be learned there. For an example, newborn screening. We've been very successful and we have newborn screening in I think 40 or 45 different states. So that's something we can help other GSDs with, because I too think it's very important to get those genetically tested, to get those diagnosed at birth. So there's not as much damage without treatment.
Is there anything else you would like to share today?
Nope, except I don't lose your hope. I see that a lot with a lot of Pompe patients is they lose their hope. And while what you have hope in is going to be different for each and every person, from better treatments to gene therapy to just having more people like you, hope is a very valuable portion of your medical care. It with hope, you can accomplish a lot more than you would ever think you could. Yeah. For an example, people with hope, I've seen so many Pompe patients who've outlived their life expectancy by throwing everything they can at it. We've obviously seen Pompe patients pass away, and from the other glycogen storage diseases, I see how the community at times it can be hard to find people like you, especially because in some places of the country it's not well known about because advocacy hasn't been there. So there is hope and things will get better, even if they don't seem like they will.
Thank you so much for your time today.
You're welcome. So yeah, that's just a really, if you want to stop recording, that's fine.